Report.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. Thanks for tuning in tonight. Tonight we have a great guest, Dr. Marc Sperber, a dentist in Lindenhurst, New York. Marc, welcome to the show.
Thank you.
And Marc is Marc's our local expert on dental implants, and we haven't had a show on dental implants, so I think it's going to be a great one for our listeners. Before we get into it, Marc, maybe just tell us a little bit about where you went to school, how long you've been practicing, that sort of thing.
I went to school at Columbia University, and I graduated in 1980. I've been practicing about 30 years. I have a general dental practice, but we do a tremendous number of dental implants, and they've been a big positive benefit for patients.
I bet you in 30 years of practice, you've seen all sorts of things come and go. You've seen revolutions, really, in dentistry. And I know you were telling me before the show that of all the changes you've seen, that dental implants has probably had the most profound impact on your practice and on your patients' lives. Why is that?
Well, they last longer, they're stronger, they're more functional than any other bridge work that we've ever had. And the beauty about dental implants is they never decay. They don't develop periodontal disease. It's a tremendous value. Patients love them.
Let's back up a little bit for our listeners who don't know anything about dental implants. Maybe just explain what is a dental implant and the whole process.
A dental implant is a small titanium post. It's placed into the jawbone where teeth were missing, and it creates a strong foundation for the artificial tooth that sits on top of it. Mm-hmm. Dental implants can preserve facial bone, which often is lost when teeth are lost. They change the way people live. People regain confidence when they're eating and speaking and laughing.
So let's back up a couple of things you said. First, there's two parts, as you were saying. There's the part that goes into the bone, which is the implant.
Right.
And that sounds like that's the anchor. And then there's stuff that's built on top of that. So how are some ways that anchor is used? Do you need one implant for every tooth to be replaced, or how are they used that way?
Well, you could have one implant for one tooth, mm-hmm. but if you're making a bridge, you could have 2 or 3 teeth sitting on 1 or 2 implants.
What if someone has no teeth in an entire arch? Do they need 32 implants?
No, not at all. They might only need 4 or 5 implants to replace an arch.
So they're so strong that you can replace a whole arch of teeth. An arch has 12 or 14 teeth with 4 or 6 dental implants?
Absolutely. It's life-changing when people get implants because it restores their confidence.
It seems like now implants are almost all you hear about in dentistry. 10 or 20 years ago, almost nobody got implants, but now it seems to be very commonplace.
It is. We have 90-year-old patients getting them. We have 20-year-old patients getting them.
So let's talk about some of those patients, maybe from 20s to 90s. So is there a typical implant patient, or what are the different ways that dental implants are used?
Well, there is no typical patient because today anybody can get them. But implants can be used to replace a single tooth. They can be used to replace multiple missing teeth. They can be used to anchor down dentures that are loose and ill-fitting.
Mm-hmm. Let's get into those one by one. So let's say that somebody loses a single tooth. Their first molar, the 6-year molar is lost, gets pulled out. The first question is, a lot of people would probably say, well, it's in the back. Why do I need to even bother to replace it for? So why is it important to replace a missing tooth?
Teeth are like bricks in a building. You pull a brick out in the middle, the other teeth start to sag. Mm-hmm. Replacing even a single tooth is important to maintain the integrity of the dental arch. It prevents collapsing of the bite. People eat better when they have a full complement of teeth.
So it's more than just that you look pretty. The whole thing functions as a unit.
Absolutely.
It's like if your heart lost one ventricle, you wouldn't say, I have 3 other ventricles. You'd want to have all 4 probably working for you.
It would be ideal.
Mm-hmm. And then, okay, so once somebody's sort of committed to replacing an implant, they're typically committed to replacing, say, a single tooth. There are 3 ways to replace it. I know that you could replace it with something removable, a tooth-supported bridge, or a dental implant. So maybe take me through the pros and cons of each of those 3.
Well, removable bridges are removable.
Mm-hmm.
That means after each meal, you got to take them out and wash them. When you go to sleep at night, you got to take it out and soak it.
Mm-hmm. Like grandma.
It's something that the generation before us did, and very few young people today choose that option.
Mm-hmm.
That's just nowhere near as comfortable as having a permanent tooth.
Mm-hmm. So why would anybody choose that nowadays, a removable bridge?
Basically because the removable bridge is inexpensive. Mm-hmm. But that inexpensive option is far from ideal.
I've read also that it's damaging to the adjacent teeth many times, those removable bridges. And so, in the long run, it sounds like, although it may be the most expensive option, if it ends up causing bigger problems.
True. There's nothing like having a permanent tooth. Mm-hmm. And really the best way to replace a missing tooth is with a dental implant.
So let's talk about now the second option, which is a tooth-supported bridge. And those have been around for 40, 50 years, probably a long time.
Well, the problem with that is the teeth adjacent to the missing tooth have to be ground down. So if you're missing one natural tooth, you have to grind down 2 good teeth in order to make a bridge. The longevity of that is between 7 and 10 years.
Now, why would a bridge only last 7 to 10 years if the dentist uses a permanent cement to cement it in place?
Because over time, the gums will change, the bone changes. Sometimes bacteria gets underneath. The adjacent teeth can decay. They can develop periodontal problems.
They can be hard to clean also, aren't they, those types of bridges?
It's much more difficult than having a single implant. Mm-hmm. It's very difficult to floss underneath a bridge.
Mm-hmm. So when someone has a tooth replaced with a bridge, for our listeners, the tooth has 2 parts. It's got the part you see, which is called the crown, and it's the part in the bone, which is the root. So a bridge that's supported by teeth on either side, the root isn't supported. It isn't replaced, is it? It's just the crown is replaced.
Correct.
So what happens to the bone, the jawbone, when you don't replace the root?
The bone shrinks. Whereas when you have the implant, it doesn't. It preserves the bone.
So when you see, the classic little old lady with no teeth and her face is sunken in, is that why it is? Because the jawbone's just melted away?
It atrophies, and over time, the denture that she's wearing gets looser and looser.
Mm-hmm. So take us through now. So we went through a removable bridge. We went through a tooth-supported bridge. And I know you were telling me before the show that in addition to decay, sometimes when you grind those teeth down, they can end up needing root canals. They can need more advanced treatment because of the invasiveness of grinding them down. So take me through the implant process now. I lost a tooth. I hear you on the radio. I come into your office. I say, you know what? It made perfect sense to me. Let's get an implant for here. What's involved for the typical patient who's going to get an implant?
Well, first we have to check their bite. We have to determine if there's enough space and enough bone. Once we determine that there's enough, the patient goes to the periodontist. The procedure generally takes 10 to 15 minutes to replace a single tooth. Mm-hmm. An implant is placed. We often wait about 6 to 8 weeks, and then we're able to restore it. An abutment goes into the implant, which is a post, and that's used to attach a crown to the implant.
So sounds like 3 visits. 1 visit to put the implant in, a visit to take the models, take the impressions, and then a 3rd visit to put it all in.
Correct.
Mm-hmm.
Correct.
And how would that compare, say, to a tooth-supported bridge? So you said the visit to put the implant in is maybe 10 or 15 minutes, and then how long is the impression visit typically?
20 minutes.
And how long is the visit typically to put the crown in?
30 minutes, 30 to 40 minutes.
Okay, so somebody's they've spent an hour and a half. Is that a fair assessment,
right,
maybe to get an implant?
It's much less time than making a bridge.
Right. So when someone's having a bridge done, how long is that visit where the teeth are ground down?
That first visit can be an hour and a half.
Just for that?
Yes, yes. And then there's try-ins and fittings. So the implant usually takes about half the amount of time as a bridge.
Do you have any patients who've maybe had bridges in the past? Maybe one side of their mouth has a bridge, the other side they decide to get an implant. Have people given you their feedback what one feels like versus the other?
The patients universally like the implant better.
Yeah, why is that?
It's more natural. It feels more secure, and the biggest advantage is you don't have to grind down good teeth.
You seem very passionate about that, about not grinding down good teeth. Why is that?
Because
you've been grinding down teeth your whole career, right?
Absolutely, for 30 years. But
it sounds like you're
in my
convinced.
mouth, if I'm missing a tooth, an implant is the only way to go.
Yeah, it sounds like you're just convinced that if there's a way to do it without grinding down healthy teeth, you would grind them down.
It's better for the patient. It's more natural.
When you first talk to a patient about dental implants, who've never had dental implant or maybe don't know anything about dental implant, what are some of their biggest concerns that they voice to you about that?
Well, their biggest concern often is they don't know what's going to be done and what it's going to cost.
Okay.
And typically the cost is a little bit greater than a bridge, but the value is better because it lasts so much longer.
So really in the long run, it's much less. I mean, you could buy a used car for much less than you could buy a new car with a warranty, but probably that new car is going to be a better value than the old car.
Yes, definitely.
So what do people typically say to you afterwards once they get over that hump, they have their implant, they're restored? How do they feel compared to how they felt originally?
People feel like they're back to normal.
Yeah.
And they have more confidence when they're eating, and they can laugh, they can chew, they could speak more naturally. People are just much more happy.
You were telling me also before the show that a lot of times, so we spoke about the younger person maybe, or really it sounds like any age. Is there an age limit how someone's too old to get a dental implant?
No. We've placed dental implants in 90-year-olds.
So how does somebody know if they're healthy enough for dental implants? What if they're worried I have high blood pressure or cholesterol? Am I okay?
That's not a problem. As long as their blood pressure is reasonably controlled, they can have them.
They can have it. Somebody had told me that really the only reason someone couldn't have implants is if they have uncontrolled diabetes. Is that true?
We would like a diabetic to be reasonably well controlled. I mean, when you're uncontrolled, it definitely is a negative.
But other than that, it's pretty straightforward.
Absolutely.
That's fantastic. So let's talk about the upper end of the age spectrum now. How are implants used sometimes in older adults, just the 80-year-old or the 90-year-old?
Well, typically they're wearing dentures that are loose and uncomfortable, and sometimes we'll put either 2 or 4 implants in just to anchor their denture. It's amazing how much better they eat, and one of the big enjoyments in life is eating.
Yeah.
And people who can eat better with more confidence, they eat a bigger variety of food. They eat more nutritious food because they're able to chew the harder foods. Vegetables and fruits take a little more effort than soft processed foods. And when your dentures are secure, you eat better.
Why do people have so much trouble with dentures? I know especially lower dentures. Can't the dentist just make a better set of lower dentures and they'll stay in?
Well, what happens over time, they lose bone and gum. And no matter how well-fitting the denture is, it's never anywhere near as secure as if an implant anchored it down.
So they move around, that lower denture. The tongue rattles it around.
They move and they create sores and irritations.
What about adhesives? Don't adhesives solve that problem?
Adhesives help, but they don't really solve the problem. They're messy.
I would think everything must taste like denture adhesive after a while.
Absolutely.
Wasn't there just something also in the news that people who used a lot of denture adhesive were getting too much zinc or something like that, and they were having neurologic problems?
They are making newer adhesives with less zinc, and that's helped, but nothing helps as much as dentures that have been anchored down with implants. And today, patients can even have permanent dentures that don't come in and out.
So let's talk about that. So let's say I have a loose lower denture and I'm having all the problems you said. I can't eat, I eat mushy foods, I take them out half the time. What are my options for a better life?
You could either get a permanent denture, or permanent teeth, and usually that involves 4 to 6 implants. Or you could have 2 implants placed that will just anchor the removable denture.
So the denture will snap in and out.
Correct.
Now, can you use someone's existing denture, or do they need a new denture to be made?
Very often we can use their existing denture, assuming it's reasonable. Sometimes we have to make them a new denture.
You mean if it's not too worn, that sort of thing, if it's
Correct.
in good condition?
Correct.
So how long does something like that take? Again, I think of our listeners at home, they just got done with their tuna fish, they're eating mush, they say, I want to call him tomorrow. What's the time like to get something like that done?
From the time the implants are put in, anywhere between 8 and 12 weeks.
And they're done.
Right.
And they're done. So when you have patients, and I can tell by your face you've had a lot of them who were suffering with a denture, had a couple of implants, and now they can snap their denture in and out. What kind of things do they tell you? What kind of changes do they experience?
It's life-changing. Patients.
Is that an exaggeration? I mean, life-changing is a big thing.
Well, when you can go out to dinner and enjoy your food, that's huge. And not only do you enjoy your food, but you can eat more types of food. Patients who are wearing removable bridge work typically tend to eat a softer diet. They eat less nutritious food. Once their dentures are anchored in by implants, they can eat an apple, they can eat celery again, corn on the cob. It's a huge difference. And when you get better nutrition, you live longer.
I would think your overall health is better to be able to eat fresh fruits and vegetables and all those things.
Absolutely.
Do most people, when they go from having all their teeth to some teeth and then no teeth and then a denture, it's kind of like their universe of what they can eat gradually gets smaller, smaller, smaller. Do most people realize
that? And they start to gain weight because they're eating
junk,
eating more processed foods. When your teeth are loose, you can't eat the more nutritious foods.
Do most people who are compromised that way realize they're compromised, or did it get that way so gradually that they don't realize it?
Most of them do not realize that they've limited themselves. But people who get removable dentures tend to gain weight because they're not eating the better foods. They're eating the softer, less nutritious foods.
What do you say to the person who says, I still eat everything I used to eat before my denture? I mean, they're getting it down their mouth, but are they really eating it properly?
You'd be surprised at how many patients develop digestive problems because they're not chewing their food thoroughly. When they get the implants, they're surprised at how well they do.
Do most people's families or their spouse realize how the denture wearer is suffering, or do they tend to keep it to themselves?
Most spouses have no idea.
Really?
Unless you're wearing a denture, you don't know what people are going through.
And does the spouse who's wearing the denture typically sort of complain, or when you sit down with both of them, does the spouse that has their own teeth say, wow, I never realized he or she was so unhappy?
Correct. Because the patient who is wearing the denture often doesn't like to complain.
I guess they're embarrassed too, that maybe they feel some shame that for whatever reason, they lost their teeth, that they almost feel like they deserve to be unhappy.
Well, sometimes.
Like they don't deserve to improve their situation.
There's a lot of patients who don't understand how much they can benefit from having teeth that are not loose.
Did you ever have anybody that had a loose lower denture, got a couple of implants, it snapped in place, and whatever it cost to do that, and in the end say, I wish I'd never done that. It was a big waste of money?
No, I've never seen that.
Yeah. What kind of changes do you see in people in their personalities once they come back for their checks and their teeth are snapping in and out?
Oh, they're so much happier. They're smiling more. They look more robust.
Yeah. Do people kind of not go back into society, but start to socialize again, eat out more, be around friends because they can be confident their teeth don't fly out of their mouth?
Absolutely.
I just read in the paper
people enjoy life more. One of the biggest enjoyments is eating, and you eat so much better with teeth that are firm, that are not loose.
There was just an article in the paper yesterday that one of the biggest determinants of how long you live is your degree of social interaction. And they looked at people that had healthy lifestyles and no social interaction, and they didn't live as long as people with unhealthy lifestyles and a robust social life. So that may be another reason why people with implants live longer, in addition to the nutrition.
Absolutely.
Wow. Now, you mentioned that people can have a permanent denture as opposed to, say, taking a denture that snaps in and out. Tell us what that is.
A permanent denture is a denture that's attached to the jawbone with implants.
Does it look like a denture? Does it look natural?
They look like teeth. The only person who knows that it's a denture is the denture wearer. Anyone who's looking at them, they just think they have teeth.
So it's like, for these people, it's like having their teeth back again.
Absolutely.
Right. Now, what about patients who, say, have a mouth full of disrepair? People who haven't been to the dentist in 10, 20 years have a mouthful of decay, broken teeth, gum disease. So they have their teeth, but the teeth are in such terrible disrepair. How do those people end up getting implants? Do they have to be in a denture first? What's the transition like?
They don't need to be in a denture. The day the teeth are removed, the implants are placed, and the very next day they get a temporary bridge that's permanently attached to the jaw. So they don't have to go with dentures anymore.
What do the people say when they have something like that and their 20 or 30 years of accumulated dental problems is solved in a day?
They're overjoyed.
I would think a lot of people stay away from the dental office just because they think my problems are so big it's going to be years and years till it could ever be fixed.
That happens, but most of them are pleasantly surprised at how quickly they can be healthy again.
Yeah. You mentioned, the first part is that the implant goes into the jawbone. So, to the average listener, that sounds very painful, putting a piece of metal in the jaw. So, what's been your experience with that?
It's a procedure that takes 10 to 15 minutes. It's easier than having a tooth removed. It's quicker than having a bridge or a crown made.
Quicker than that?
Yes.
And is the average person asleep, awake?
Most people are awake, but if they want to be asleep, they can be.
And that's it. Couple stitches and they're done.
That's it. A little bit of Novocaine. It's a very fast, very easy procedure.
Is there a lot of swelling, bruising? Do people have to be out of work for a week or 2 weeks?
It's sore. It's a little uncomfortable for a day or so.
But nothing, doesn't sound like anything terrible.
It's easy.
What about, you mentioned that one of the biggest drawbacks or concerns people have about implants is the cost. And although it's sort of a drawback, I mean, it really sounds like it's the best value in terms of anything there is in dentistry. And I give you a lot of credit. You're sort of going to put yourself out of business. If you replace teeth in the most durable way, you don't have to redo dentistry as often. So
that's a joy for everybody.
Yeah. What are people's other concerns aside from, maybe that it's going to be expensive? Do people worry that they're going to take? I hear, people a lot of times say, "Is it going to take in my mouth?"
Yeah. Well, we have about a 95% success rate, which is one of the best things we do in dentistry.
Is anything else that high? Are root canals that high? Is anything 95%?
No. Root canals have an 85% success rate. There's nothing in medicine or dentistry that's 100% for everybody, but 95 is as high as it gets.
Yeah. So people, and typically if the implant doesn't fuse with the bone, if it fails, is it just replaced again and it's done again?
Yes.
And most times it's successful the second time?
Absolutely.
Yeah. What about smokers? Can smokers have implants?
They can, but we'd prefer that they don't smoke, but they can have them.
Yeah. One thing you said before that intrigued me was, if someone has a lot of decay in there, that these don't decay. So, if you think of...
It's a huge benefit.
It seems like people are never rid of decay. They get a cavity as a kid, it's replaced a second time, and then the filling is so big it needs a crown, and then the tooth needs another crown, because the decay doesn't stop. You just forestall it coming back.
Right, but with an implant, that never happens. The implant is made out of titanium. The abutment is made out of titanium. It's a joy.
So for people that always get decay, implants, no decay.
Absolutely.
For people that have had a mouthful of root canals, implants, do they need root canals?
Never.
No. For people that have lost their teeth to gum disease, can implants get gum disease?
No. There's no periodontal ligament around the implant, so they don't get gum disease around them.
What type of maintenance do implants, require? Does someone have to be a super cleaner, or what's involved with that?
We like them to brush and floss.
But is it any more than really what they would need to do around their natural teeth?
No, it's exactly the same.
Wow, that's really something.
And it's so much easier than if you had a bridge, which is very difficult. A bridge is very difficult to clean underneath.
I know you said before there's no average implant patient, but, is your average implant patient sort of the average working class guy or family? I mean, implants only for the wealthy, or is there a way that everybody can sort of fit them in their budget?
Absolutely. We have young people, elderly people. We have people who, from all walks of life. There is no typical patient anymore.
Mm-hmm. But do you find that that the average person, when they really appreciate the value of the implant, kind of finds a way to fit it into their budget when they maybe compare it to their cable TV bill or their iPhone bill or all that kind of stuff?
Of course.
It comes down to value.
There is no better value in dentistry today.
Yeah. What about insurance? Does insurance typically cover dental implants?
There are some companies that are starting to cover a portion of the cost.
Mm-hmm.
Dental insurance companies are happiest when you choose the least expensive option. They love to see everybody get removable bridges because it's inexpensive. But the best option is always a permanent implant.
Something that doesn't come in and out.
Absolutely.
Yeah. What about also, I know we were talking before the show, when you flip through the paper, you see these places, implant, $3.99, $2.99, $1.99, we'll pay you $100, come into our office, we'll give you an implant. What are some of the problems you've seen with those over the years?
You get what you pay for.
Yeah. But isn't an implant an implant an implant?
No. There's 200 or 300 companies that produce implants. Mm-hmm. You can get an implant from a company that's been doing it for 20, 30 years with good research, and you could also get an implant that's made by a company that just started making them.
Mm-hmm. What about the lab work too? I know you were telling me that there can be a real variation in terms of the lab that makes the crown.
Absolutely. You want to use a good lab. You want to use somebody that's been doing this for many, many years. You don't want a fly-by-night place. You don't want somebody using knockoff parts. And
I would guess the patient never knows. The patient's never going to know when it's going in if they're getting the real stuff or the knockoff until 2 years later, 5 years later, they have a problem.
Right. You always want to go with the best.
Mm-hmm. What do people typically say to you when they had a job, sort of they went for one of those deals and then you had to fix it or it break? Do they sort of regret having taken the cheap path and then have to spend twice as much to redo it?
They're sorry.
Yeah.
It's always best to go with the brand name, the well-known, the better quality, the
time tested. It's funny. People, so many people are loyal to whoever cuts their hair. I only go to this person. She does my hair. Cuts my hair, colors my hair. And if you said to that person, "Hey, just call around to the absolute cheapest place who'll do it," they would think that's absurd. I would never do that. And yet sometimes people flip through the paper and bargain hunt for the cheapest implant, not realizing it's a service just like any other. And I like what you said, that you get what you pay for. I think people don't always realize that in dentistry.
Absolutely.
Yeah. So in the last couple of minutes, what would you say to some of our listeners maybe who are suffering with a denture at home or have that missing back tooth that has sort of been hemming and hawing and wondering, should I do something? What should they do to take the first step?
They should make an appointment with their general dentist. That there are new options that are much better than removable bridges that they've been living with.
Why do some dentists, it seems like some dentists like you are really progressive and have embraced modern dentistry and dental implants and the miracle that they are. And then there are some dentists that are really very happy still just to grind down teeth all day long and don't get involved with implants. Why are some people so slow to embrace these proven technologies?
Change can be difficult for people.
Yeah.
Unless you keep up with the current trends and are familiar with the new options, some dentists just want to do what they used to do, but technology has made life-changing benefits for patients.
I know you were telling me before the show that you really, you've been a dentist 30 years, so 30 years ago there was no such thing as dental implants, so you really have taken hundreds and hundreds and hundreds of hours to perfect this part of your practice, to perfect this skill, and I think the average listener probably doesn't realize how much effort it takes to stay current and to incorporate these new technologies.
Yeah, you got to take classes all the time.
Yeah.
But just like their computer at home, every couple of months there's something better.
Mm-hmm.
Fortunately, we have gotten away from having to grind down good, healthy teeth, and we've gotten away from having removable dentures.
Yep. So, if any of our listeners want to get in touch with you after the show, maybe you could just tell us where you're located, what your website is, phone number, that sort of thing.
Well, I'm in Lindenhurst on Sunrise Highway, and my phone number is 631-226-5252. We do have a website, SperberPortnoy.com. We'd be happy to see them.
Great. So if you're missing a tooth or you have a loose denture, you don't have to be miserable. Pick up the phone, give Dr. Sperber a call, or give your dentist a call, and start living life again. It sounds like there's a lot you can do. Marc, I want to thank you for being on the show tonight. You were a great guest. I knew it was going to be a good show. You didn't disappoint.
Thank you for inviting me.
You're welcome. You've been listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. We'll be back next week. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.